Hey y'all, welcome back. This week's video, we're going to talk about systemic estradiols. It's going to be an introduction so that you can be better equipped going to talk to your doctor about these different types of medications to see what may or may not work best for you. It's by no means going to be the most all-encompassing video, and in general, I'm going to go from the more affordable ones that I often will use, to the ones that are a little less accessible or more expensive that I don't use quite as much. But just to start off with, why in perimenopause and menopause would we recommend systemic estradiol? It can target a lot of different symptoms of perimenopause and menopause, thinking anywhere from the common hot flashes, night sweats, brain fog, some trouble sleeping, things like that, in the more, you may think, short term, but also we are getting, even this month there was a new study that came out to show the positive benefits of a systemic estradiol level around 60 for bone health and cardiovascular health regarding, they were talking about cholesterol numbers. But needless to say, there can be several benefits. Obviously, as we go through the different formulations, I'll let you know some of the cons or potential side effects, but in general, these are usually very well tolerated. So let's just dive in. Let's start talking with the pill version of estradiol, and this can range from, half a milligram to 2 a day. It is the most cost effective, to be honest. It's easy, it's a small pill. Most people are very comfortable taking a pill, and you can do it 1 or 2 times a day because the time that it's in your body active is not the longest amount of time. So you may think, well, why don't we use it more? Well, the side effects of taking a pill like this by mouth just make many of us who do menopause care a little antsy. So because you take it by mouth and you get this first pass metabolism through the liver, you are more likely to see side effects that are not as benign, I guess I'll say. So higher blood pressure, cholesterol, kind of like triglyceride impacts, and maybe migraines, especially if it doesn't last as long in the body, other neurologic complications, increased risk of clots, stuff like that. Now, is this increased risk of clot the same as with pregnancy, major surgery, or even birth control pills? No, the dosing's not as high and the systemic levels are not as high, but still the risk is there, especially because as we get older, closer to perimenopause and menopause, much of the population has some sort of chronic disease or diagnosis, such as high blood pressure or high cholesterol. So if people are kind of a chicken like me, I like to err on the side of caution and go with another option if I can. Obviously, this is a joint discussion between the patient and myself, so I have on rare occasion had a patient choose the oral formulation when we talk about all the pros and cons, and they can decide for themselves. Anyway, I digress. I'm going to move on to probably my preferred option. There's a couple forms of this, but I like to do the patches. There is a once a week patch, and there is also a twice a week patch. I will say that I tend to prescribe the twice a week version more, and that is for a few reasons. One, if someone has an adhesive intolerance, maybe they get itchy or break out at the site, that just leaves it to where they're switching the location more often, and you're less likely to get this as a side effect. The other is it tends to be noticeably giving an improvement in symptoms quicker. So the once a week is a bit more steady, whereas the twice a week you may notice symptom benefit better. You also, because you're switching it more often, can use that time to adjust the dosing as needed. It also is something like during the summertime right now when people are more sweaty, they're swimming, stuff where their skin's just going to be more moist. Occasionally I'll hear that the once a week patch just doesn't stay on the whole time, and then there's issues with the pharmacy if you run out of patches early because they're falling off early. So those are some of the side effects, or not side effects, nuances why I may choose once a week versus twice a week. But I will say the once a week versions are usually a bit cheaper. These vary in price because a dose more often. And right now, like, you know, middle of 2020, we're having some supply issues with patches and things. So I have seen just a big diversity of prices depending on the patch type, dose, insurance or not, you name it. Anywho, if you think about systemic estradiol, something I didn't mention with the pills, but is pretty applicable to most types of systemic estradiol, common side effects could be breast tenderness when starting. Often this is tolerable. No one has to stop taking it, and it goes away in a week or so, and people are fine. People could get more headaches or migraines, though that tends to be more if it's more like quick on, quick off, or much higher, lower dosing than they need if there's a history of migraines. And that's something I'll talk with patients about. You could get some abdominal side effects, abdominal pain, pancreatitis, things like that. Something I never see and have not had a patient or other prescriber tell me they've had this incidence of. Theoretically, you could get some of the other neurologic or cardiovascular side effects. There's been a lot of studies recently have refuted some of the WHI claims that were in the media more so than actual scientific evidence. And these are all that I've mentioned so far, like the... And my phone cut off, so we're just going to pick up where I think I left off. I was pretty much finished up talking about patches and logistically some shortages there. So another type or route I've been using a lot more recently is actually the gel. This again comes in a few different brand names or prescriptions. Often I'll use the generic DuaVee gel, which comes in packets, and you'll use one packet per day, but there are some formulations that are a pump, so you use a certain number of pumps per day. And this can vary depending what dose you need and whatnot. But it is nice, especially if people are, one, currently having an issue getting patches, or if there is still an adhesive intolerance, say due to the adhesion of the patch, whereas the gel, you're not gonna have that issue. The DuaVee gel generic that I typically use, it's often easy for people to make a habit out of using it because it is once a day. For many people, I should say once a day. But anywho, it is something till it dries down wherever you end up putting it. You do have to be careful not letting pets or kids or anything like that touch where it's not dried down yet. And then some of the gel mist formulations can be flammable. Not that I hope you're using them near an open flame, but just something to keep in mind until it is dried down. So like I just alluded to, there's also a mist. This is something that is a little more expensive, so I don't usually prescribe it for patients when we go through a bunch of the options. But it's similar to the gel. It's just a spray instead, but anywho, easy peasy. There is one interesting systemic option that I actually am very excited to share with you. It is called the Fem Ring. I have actually not used it on a patient because it is a little costly, but it has so many benefits that if it was cheaper, I think I would use it more. But it is a vaginal estradiol, so not having to worry about it being out on the rest of the body to touch, where when it's inserted, it has a higher dose estradiol, so you can not only get systemic estradiol benefits, but also local ones, because sometimes, especially with the pills or a few other formulations depending on the dose, some patients may need to use additional vaginal hormones, which I'm going to do my video about next week, so stay tuned for that. But this one you can get 3 months worth, kind of set it and forget it, of systemic and local benefit. It's just really the cost, but it's, I mean, fairly, if you can insert something vaginally or go to the doctor and have them do it if you have any mobility concerns or what have you, just discomfort in inserting it, that is such a good option. There is a lower dose option called an E-string. Again, not one I've used a lot of time for cost effectiveness purposes. And I'm going to talk about it again with the vaginal hormone video, but it is not the same. So it does not provide any systemic benefit. So if you do see some kind of vaginal pessary insert, whatever you may be describing it as, just know there's two different ones, and it is important to know that because one has systemic estradiol. So if you have a uterus, you will need systemic or local endometrial protection with a progesterone or progestin of some sort. Again, this will be another video, but that does take me to the point of, if you do have a uterus in place, you can get stimulation of the endometrial tissue if you're doing systemic estradiol. So you need to make sure you're doing some form of progesterone or progestin, which is the synthetic version, to keep your endometrial lining protected so that we are not getting increased risk of endometrial cancer. There are a couple of systemic options with estradiol as a combination to make this a bit easier. They're not something I give out a whole lot solely due to them being more costly, but there are a couple of patches like a Climara Pro or a combo patch, where in the Climara Pro there is an added progesterone, and the combo patch, it is a progestin of norethindrone acetate. So if you're someone who's a little more sensitive to like androgens or like more testosterone side effects, that might be something where you may not want to choose that one. But if you really wanted to cut down on the number of prescription items you have and combine as much as possible, this does combine a 2-in-1, or these options combine a 2-in-1, which is really nice. I am going to do a separate video about the progesterone options, so stay tuned for that in a few weeks, but it's just a little intro here if you are thinking about using a systemic estradiol. If you do not have a uterus, then you're in luck. You don't have to do that. You may see other benefits on sleep and whatnot by using a progesterone like micronized progesterone, but you don't have to necessarily. I think that's most everything. I'm trying to think of common questions that I get when it comes to this. I use this talk when I'm going through the estradiols as an opportunity to make sure I'm caught up on a lot of my health maintenance, breast cancer screening, cervical cancer screening, and what have you. But if you really are looking through the data, it's something where you're not getting an increased risk of that. So it's not that I'm scared it's going to cause an issue. It's just that if there is a cancer that is hormone sensitive or receptor positive already in place, I may be cautious in what I recommend knowing that information. So I hope that makes sense. I don't want to scare anyone away in that regard. And it is definitely something I think is important. I mean, I've unfortunately, in my short career as a family medicine doc, so far over the past 5 or so years, had to tell patients that they have an abnormal mammogram and we need to do more and get a diagnosis of breast cancer. And a lot of times these are women who don't have family history, they're younger. So I'm a huge advocate of that, and I just like to plug it in here when I can and make sure we're staying on top of things. If you have any questions in general about the systemic estradiol options, I'd love to hear them below. And I know this was a quick intro, and by quick I mean it's still like 20 minutes long almost, but we definitely can get more in the weeds in the future if people are having a lot of questions of a common theme.